We can tell you that Mayor Adams launched a controversial plan to remove people with severe mental health challenges from streets and subways.
The mayor says it's a moral issue and he has to act to address what he calls a crisis. Adams wants to provide care for the untreated mentally ill.
But those people will not have a choice. Under the plan, they will be taken to the hospital involuntarily.
CBS 2's political reporter Marcia Kramer is here now to tell us about this decision.
Well, Dana and Dick, it was bold, it was controversial, but whether you agree with Mayor Adams or not, his decision to force people with mental issues to get treatment is a decision that comes from the heart. He said his concern began when he went to see homeless encampments erected in the city.
Seeing human waste, stale food, dirty clothing, people who are dealing with mental health crises, and then we have the audacity to say that they should live that way? I'm just not going to do that.
Mayor Adams, facing an issue whose solution has eluded mayors for decades, announced a controversial plan to involuntarily bring people with severe mental illness into hospitals for treatment, taking them off the streets and subways. He said it was both for their safety and the safety of the public.
We're going to be more responsive, we're going to be clear, we're going to be compassionate, but we're not punting this issue. We're going to face this issue head on.
The mayor issued a directive to first responders and outreach workers, telling them they had the legal authority under state mental health law to bring people to hospitals who are a danger to themselves or can't meet their own basic needs. The mayor said he would find a way to provide psychiatric beds for anyone who needs them. Governor Hochul gave the city funds for 50 beds. I asked the mayor where the additional beds would come from.
We're going to be meeting with our private hospitals and state that we're going to need help from the private hospitals as well to open psychiatric beds.
The mayor also proposed an 11-point Albany agenda to close gaps in the state's mental hygiene law. It includes making the law explicit that a person requires treatment when their mental illness prevents them from meeting their own basic needs, and requiring hospitals to screen all psychiatric patients prior to discharge so they can get outpatient treatment. Brendan McGuire, chief counsel to the mayor, said state law already gives Adams the right to issue the directive.
Certain conditions have to be met, and that's been laid out in New York State Office of Mental Health guidance.
The New York Civil Liberties Union accuses the mayor of playing fast and loose with the legal rights of New Yorkers, calling his plan a page from the failed Giuliani playbook.
Acting as if you can sweep a problem out of public view, right, and it'll go away. Well, it doesn't go away. It doesn't provide the treatment that's necessary for a long-term solution, and it causes great harm to individuals who are themselves hurting quite a bit.
Advocates with Vocal New York called the mayor's plan draconian, arguing it will push people further into the shadows.
If people know that they might be labeled with some type of mental health issue, they're just going to go deeper underground.
Legal Aid's Jeffrey Berman says the state legislature must end the revolving door of prison.
Are we going to keep them in jail, where they are again exposed to violence and drugs, or are we going to divert them into meaningful, robust community treatment so that they never ever get arrested again?
Well, the mayor said that the program could also be applied to those who aren't homeless. He urged New Yorkers to become what he called trauma identifiers and to call either 311 or 911 to get help for people they see are in need of help. Dick and Dana?
Marcia, we've been here before. These discussions about first responders, outreach workers there, seeing a problem. How is that going to work? What are they saying?
Well, the city's going to set up what they call a hotline so that outreach workers can call a clinician and talk about the person that they're thinking about bringing in for treatment to see if they actually should bring them in. So this will give them the opportunity to use like an iPhone or an iPad and actually show the person that they're talking about so that it gives them a little bit of more information about the kind of behavior they have to evaluate.
But an awful lot of opposition to come.
Yeah.
I think it's going to be a tough haul in Albany, that's for sure.
Yeah, sure. Okay, Marcia, thank you. And we stream Mayor Adams' announcement on CBS News New York. For more information on his mental health plan, go to our website, cbsnewyork.com. We posted the mayor's entire news conference.